Hi, I'm presenting the second episode of stroke in continuation of the first episode, which was able to introduce how stroke come into place. I want to emphasize more on how blood pressure could eventually cause stroke. In the last episode, I mentioned that there is occlusive and there is hemorrhagic type. The occlusive type is the most common. 80 to 85% of cases is occlusive, while 10 to 15% is hemorrhagic. And the 10 to 15, the hemorrhagic is more deadly than the occlusive. The blood pressure build up from as a result of maybe our lifestyle factor. Some people they take high salt intake, we get too fat when we are not active, lack of exercise, smoking, all this causes damage to the blood vessel. And so this reflected in systemic blood pressure. Also, when there is another like condition like kidney disease, thyroid function disorder, adrenal gland issue, there can be systemic hypertension. Also, when there is increased cardiovascular output, systemic vascular resistance, and increased blood volume, and so there is stiffness with age, blood pressure, systemic will increase. Also, when there is increased sodium retention and water retention, and also there is as a result of too much stress or injury to the blood vessel, there can be systemic blood pressure increase. Also, when there is overwhelming problem that affect the vessels or circulation generally, there can be systemic blood pressure. The systemic blood pressure, when it's not well controlled by the maybe presentation to the experts, it can further cause increase in intracranial pressure, and so there will be increase in cerebral blood pressure, and so there will be overwhelming brain protective autoregulation mechanism, which will be damaged. And so because of that, there is vascular damage and brain edema, which can cause cone of the brain. And like I said, smoke is the final clinical expression of vascular pathology in the brain, where blood vessel will lead to staph neurons of oxygen and glucose. Also, when there is ruptured vessel, there will be release of chemicals that cause massive destruction. And so because of that, there is too much pressure on the brain tissue. And so there will be stroke. Thank you. Watch out for another episode.